Alyssa. I'm going to be your student nurse today. I'm going to perform hand hygiene. The door is closed for privacy. Your bed is lowered, locked, call light is within reach, and your room is safe. I have cavity wiped my desks and my tables, my stethoscope and my pen light before starting. So it looks like I have orders from your physician to insert a Foley catheter to help with your urinary retention. Can you tell me your name and date of birth for me? Perfect, and that matches my MAR here too, so we are good there. I've confirmed your orders for the Foley catheter. Do you kind of know the process of how this works? You do, so I'm going to clean your genitals, kind of do like a bed bath, and then we're going to insert the catheter, which is a sterile process, okay? So before I start, I would make sure the bed is raised to a comfortable working position for me, but I'm unable to do so right now. I would also make sure my patient is in a dorsal recumbent position for the purpose of a catheter insertion. I would also palpate and assess the abdominal area to know any distension or abnormalities, which I do not feel any, so we are good there. Do you have any allergies to latex, hydrogen peroxide, anything that would irritate your skin or genital area? No? Okay, perfect. So we don't have to worry about that here. I'm going to start by placing a towel down just to protect the covers, and I also reposition the blanket to a comfortable position for her so that she's only exposed where she needs to be. I have the Foley catheter kit here. It is intact and not expired. I will place that over there for now. I'm going to don gloves, and we're going to start with perineal care. Can you check this temperature of the water to make sure it is okay for you? It is? Okay. So we are going to start by washing, we're going to rinse, and then we're going to dry the perineal area. So we start with a clean start. And I'm going to fold it so that each wipe I can use a different surface. So I'm going to go front to back. 1, get a different surface. 2, and 3. I'm going to discard that. Now I'm going to rinse. One, 2, 3. Discard of that. And I'm going to use another towel to pat dry. Discard of that, and now I'm going to discard my gloves and perform hand hygiene. So now we're going to come over to the Foley kit. I'm going to get down on my knees so that I don't break sterile field. I am going to remove my package. I'm going to turn it how I want it. And then I am going to save this bag for later use. I'm just going to set that right there. So because this is a sterile field, I'm going to open it away from me so I'm not reaching over. I'm gonna grab these corners and grab that. I'm gonna grab this drape here and I'm going to put it down shiny side down first. I did not reach over. Now I'm going to grab my gloves. I have 1 inch of bare skin to reach over my sterile field. Same with these gloves. I'm only grabbing within 1 inch. I'm going to start with my dominant hand, so I'm going to reach over with my right hand and grab the outside. I'm going to carefully put on my gloves. And now I'm going to go inside the cuff, and because of course these gloves are sterile, I am only going to keep my hands above my waist, and I'm also not going to put my back towards my sterile field. I'm finished with this, so I'm going to discard of that. And now I have 1 inch of bare skin to reach over my sterile field. I'm going to get rid of this because this is only for males. I'm going to grab this and turn it. I'm going to use this hydrogen peroxide to pour over my cotton balls so I can cleanse before inserting the catheter. So I'd open this and pour it all over my cotton balls. So that is good. Now I'm going to grab my lubricating jelly and put that over there. I'm going to open this and put my lubricating jelly in the corner right here so that it is there when I'm ready to use it. And I'm just going to rip this off, making sure that my catheter stays within my sterile field. Now I'm going to grab my syringe and attach it. I'm aware that I am reaching over a little too far. Now I'm going to cleanse the perineal area before inserting the catheter. My right hand is not going to be sterile anymore as I'm going to hold it. So I'm going to grab my clippers and I'm going to grab each cotton ball with the hydrogen peroxide and cleanse. As of now, it's sterile, but once it touches, it is not going to be sterile, so I'm not going to reach back over. I'm going to dispose of it into my trash can. I'm going to do this 3 times. 2, 3. Alright, so that is done. I'm still not sterile with this hand. I'm going to move this over here, and this hand is still not sterile. I'm going to have you bear down when I count to 3, okay? I'm going to insert it, and as soon as I see urine, I'm going to insert it 1 to 2 more inches to make sure that it's not in the urethra. Then I'm going to monitor my patient's face to know any grimacing, moaning, or pain, because that might be a sign that it's still in the urethra. So I'm going to grab my lubricating and I'm going to insert. So 1, 2, 3. I'm inserting. And I do see urine now, so I'm going to insert it 1 or 2 more inches. And I'm going to take my right hand and pinch it so that it stays in place. And I'm going to grab my syringe And I'm going to fill the balloon with my sterile water to secure it in place. At this point, I am not sterile anymore. I do not need to be sterile anymore. Once the balloon is filled, I am going to tug to make sure it's in a good position. And I'm going to remove my syringe. I'm going to remove my sterile gloves and perform hand hygiene. I'm going to immediately monitor how much output is being put out, and if it's greater than 800, I will clamp it, and if it's greater than 800, within 1 to 2 minutes, I'm going to clamp it because it could cause muscle spasms, and we do not want that. So I'm going to apply new gloves. And I'm going to attach it to the leg on the side here so that it's not tugging, but it is secure and not pulling. I'm going to attach my bag to the side of the bed to where it's not movable. A non-movable area on the side of the bed, and make sure it's lower than the bladder. So I've done that. I'm going to reassess the abdominal area, and I'm also going to measure the output, the color, the clarity of the urine, and document that. I'm going to remove my gloves and perform hand hygiene. In this case, I am going to remove my patient's catheter. I would clean up my space. I would make sure my patient is comfortable, the bed is lowered, locked, and call light is within reach before I leave the room. I make sure both the rails are up for safety, but I am going to go in and remove the catheter. So I'm going to don clean gloves. This is not a sterile process now. I'm going to grab a 10 milliliter syringe to deflate the balloon. I'm going to unattach it from the leg. Perfect. And I'm going to attach the syringe, and the pressure of the balloon will deflate it itself. So I'm going to let it do it itself until it's finished. I have a white towel so that when I remove the catheter, I can assess the urine output and know if there's any weird discharge, mucus, or blood. So it's still deflating. I'm going to leave the syringe on so it's flexible if needed. Okay, so the balloon is deflated. I have that vacuum seal. So I'm going to cover with my towel and remove. And I do not see any weird blood discharge or mucus, so I can discard of that. And I'm going to wrap it around my hand, my gloves, and remove my gloves. Based on my hospital's policy, I can discard the catheter in the trash can, but I would make sure to empty the Foley first and document my findings there. So I'm going to just discard that in the trash can and get hand sanitizer. I would ensure my patient knows the importance of urinating in the next 8 hours and to let us know. We want to make sure that your bladder is working without the Foley. So it is crucial that you let us know that you're urinating within the next 8 hours, okay? I'm going to make sure the bed is lowered, locked, call line is within reach. The room is safe. I'm going to clean up my supplies, and I'm going to go document my findings.